75,000 healthcare workers are on strike across 5 states.
Picketing began this morning at Kaiser Permanente hospitals. The company, as you may know, is one of the country's larger insurers and healthcare system operators. Now, while doctors are not participating, strikers do include technicians in emergency pharmacy, radiology, and surgical departments. Workers are demanding better wages and that ongoing staffing shortages and workloads be addressed.
For more, we're going to bring in senior healthcare reporter for Axios, Tina Reed. Hey there, Tina. So tell us what this strike means, first of all, for patients. What immediate impact might they see, and what kind of ripple effect could it have?
So for starters, primarily this strike is happening at hospitals and medical facilities in California, with some additional walkouts occurring in Oregon, Washington State, Colorado, and Virginia. Kaiser has said that its hospitals and emergency departments will remain open, that it'll work with contract workers, particularly in critical care areas, to make sure care continues as normal. However, they have said some patients with elective or non-emergency services may see those rescheduled. As you said, this is impacting surgical techs, emergency department techs, ultrasound sonographers, x-ray technicians. So there's a number of different areas where patients maybe see some impact.
Now, we understand that as of this morning, the hospital system and those representing the staff were talking. They were still trying to avoid what's now taking place. What are the major sticking points that's causing all of this?
Yes, both sides said they were talking all night, actually. And the biggest sticking point seems to be the wage increases. Kaiser's current offer includes across-the-board increases from 12.5% to 15% over 4 years, as well as a $21 minimum wage across several states. However, it's proposing the higher wage increases in Northern California as well as Washington, and lower increases in the other states. And the union is saying they want across-the-board unified wage increases. There are also some sticking points that have to do with protections against some outsourcing of jobs and protections for remote workers that have been sticking points. Both sides say they're moving closer on some tentative agreements in those areas.
Well, the healthcare industry as a whole really saw a mass exodus of about 5 million workers in 2021, 2022. So how does the industry even begin to replace so many lost workers, and how does that play into this strike?
So the unions would say that a lot of very qualified workers have actually left because of the conditions in healthcare across the industry, saying they're overworked, they don't feel like they can offer the care that patients deserve, and so they're leaving. So just increasing wages and increasing staffing might actually create some solutions themselves. However, there's a lot of other solutions that are out there that are going to be necessary, including increased investments in training for new providers and new technicians, et cetera. And then also technology is going to probably play a role here. So a lot of hospitals have looked to programs like Hospital at Home, where they can actually provide the care in the home, but that also requires fewer people, and the union probably isn't going to be very supportive of that. So there's a number of solutions, but it is going to take a number of solutions. It's not just going to be a one-size-fits-all.
All right, Tina Reed, thank you.
Thank you, Tina.